Hello, good afternoon, everyone. My name is Alex Lim. I am the ACT Consortium Manager, and I wanted to thank you for joining us for our February webinar. So this month, we are delighted to have a special topic presented by a close collaborator, CanReview, entitled CanReview, Advancing Clinical Trials Through a Pan-Canadian Single Research Ethics Review System. This will be presented by Susan Marlin, Donna Lilly, and Matthew Descanio from the CanReview team. Today's presentation will be followed by a Q&A period, so we encourage you to put your questions in the chat box throughout the talk, and we will address them as quickly as we can. Please note that today's talk will also be recorded, and there will be a second session later this week on Thursday. As the ACT Coordination Center is located at the Population Health Research Institute, PHRI, in Hamilton, Ontario, we wish to recognize and acknowledge that we are located on the traditional territories of the Mississauga and Haudenosaunee nations and within the lands protected by the Dish with One Spoon Wampum Agreement. This agreement was created to bind the nations of the Haudenosaunee Confederacy to the Great Law of Peace. The Dish represents the shared land, while One Spoon reinforces the idea of sharing and peace. We hope to bring a similar spirit of collaboration to the work being done by the Canada-wide members of the ACT Consortium. So a little bit about the ACT Consortium. The Accelerated Clinical Trials Consortium was funded by the Canadian Institutes of Health Research in 2022 and was established to facilitate, optimize, and accelerate the conduct, implementation, and results translation from high-quality, high-impact, randomized controlled trials to improve health in Canada and around the world. ACT's governance model is composed of 23 committees and working groups, and today's webinar is brought to you by the ACT Ethics Working Group. In Canada, we know that researchers often have to obtain anywhere from 5 to 9 research ethics boards approvals to conduct a trial at sites across Canada. Many Western countries have developed a single national REB approval process to minimize the bureaucracy of conducting clinical trials. During the ACT Consortium meetings in 2023, we discussed and received an overwhelming endorsement to proceed with establishing a pan-Canadian single national REB review and approval process with strict timelines for multi-center RCTs. ACT then held a focus meeting to consult with national and international experts and stakeholders to discuss developing such a system for Canada in February of 2024. From May through August of last year, ACT successfully held an open competition to select the group that would lead and run such an initiative. An international selection committee led by Megan Singleton from the US and Matt Westmore from the UK chose the CanReview team as the successful applicants to run this important initiative. It certainly has taken us some time, lots of meetings and consultation across the ACT collaboration, and a very involved RFP development process and adjudication to get us to this point where we now have consensus and a clear mandate to build a cross-Canada single REB system. CanReview has made a lot of progress since the RFP result was announced before the holidays, and it is important that we move forward with this as a community together. We appreciate all of you being here today to learn more about CanReview and how you can support the collaboration. And with that, we would like to introduce you and welcome today's speakers, and I'll introduce each one separately. So I'll begin with Susan Marlin. So Susan Marlin is the President and CEO of Clinical Trials Ontario and the nominated principal applicant for CanReview. Prior to serving in these positions, she was the Associate Vice Principal of Research at Queen's University and also worked with the National Cancer Institute of Canada Clinical Trials Group, leading the development and implementation of the Ethics and Regulatory Office. Susan has served as President of the Canadian Association of Research Ethics Board, as a member of the Canadian Institutes of Health Research, Research Integrity Committee, the Ontario Cancer Research Ethics Board, and the Tri-Agency Panel on the Responsible Conduct of Research. She was awarded the Queen's Elizabeth II Diamond Jubilee Medal in 2012 in recognition of her work in support of military and veteran health research. Welcome, Susan. The next speaker is Donna Lilly. So Donna brings her experience as a caregiver to the CanReview leadership team, as well as the CTO College of Lived Experience, where she has played an active role in co-leading key projects, including the Patient and Public Perspectives on Decentralized Trial Survey. Donna is a retired healthcare professional who has spent many years in diabetes care management and treatment, which involved working with healthcare professionals across Canada and all levels of government. Donna continues to use her skills in volunteer activities with CIHR and Sick Kids. Donna recognizes the many challenges families and friends face within the healthcare environment, particularly in later years, and welcomes opportunities to influence change and support improvements with input from patients and caregivers. In 2024, Donna became a member of the CTO Board of Directors. Welcome, Donna. And last but not least, Matthew Descanio is the Director, Streamline Research Ethics Review at Clinical Trials Ontario. Matthew is responsible for providing leadership and expertise in research ethics review processes and oversees CTO's Streamline Research Ethics Review system. Prior to this role, Matthew served as the manager of the Oncology Clinical Trials Department at Trillium Health Partners. Matthew has also worked as a project manager at the Hospital for Sick Children and Sunnybrook Hospital. Matthew holds a Bachelor of Science in Human Biology and Physics from the University of Toronto and a graduate certificate in clinical research from Humber College. Welcome, Matthew. And now I'll hand it over to the CanReview team for the rest of the presentation.
So thank you everyone for attending this webinar today. As Alex mentioned in his opening remarks, we are very glad you're here. We're very glad to hear from you and how you might help us to make this happen across Canada. So CanReview, collaborating to build a single research ethics review system across Canada. So this next slide, thank you, Elise. It's really just a brief overview of where we've been in Canada when it comes to a single research ethics review for clinical trials. So really, we've had a long-standing precedence of using a single research ethics board for multiple institutions or multiple research sites. We have centralized REBs in Canada, such as OCREB, the Ontario Cancer Research Ethics Board, HORIBA, which operates out of Alberta Innovates and provides centralized reviews. We, for years and years, as long as I've been around this business, we've had, for example, university REBs, like one REB serving several hospitals. And now in jurisdictions in Canada and across the world, we have many examples of single REBs reviewing on behalf of multiple sites, including in Ontario, Quebec, UK, US, and this is not at all exhaustive. And of course, we've had private IRBs operating in Canada and elsewhere for years, providing single REB reviews. So we've been able to do this for a long time. Institutions, and we know this from the Tri-Council policy statements, that institutions can choose the REB or the REBs that they choose to delegate research ethics review to. There are some exceptions to that are legislative, but they're starting to decrease over time, which is a really good thing. So institutions can do this, and when they do this, it's helping to advance research and creating efficiency. So this is something we really hope that more institutions across the country will get on board with. The other thing I'd like to note is that we have excellent, really high quality research ethics boards all across Canada. We're looking at a distributive model where boards across Canada can join in the process and be the single board of record. And there's such capacity and high quality, and in many ways harmonization already across the country that I think will facilitate this. So despite all of these good things, including our policies, such as the Tri-Council policy that supports what we're trying to do, even though we've known how to do this and we've done this in many cases, there is still a lot of repetition and redundancy with the same ethics review application being reviewed at multiple REBs across the country. And when I say the same ethics review application, it's not actually the same instance, it's separate REB applications being submitted within provinces, sometimes across provinces for sure, to approve the exact same study. So this, of course, results in delays and costs when it comes to starting trials. And of course, it results in lost opportunity for Canadians who are looking for trial opportunities and for general investment opportunities for Canada as well. We're constantly being informed that we're not as fast as certainly some industry companies would like to see us. We're not as fast as many investigators would like to see us be, for sure. And on top of that, we're not very predictable. So the work that we're trying to do here is really going to impact all of that. So next slide, please. And I'll hand it over to Donna, who will talk more about the impact on participants and patients. Thank you, Donna.
Thanks, Susan. Well, we certainly know it's important, and we're certainly ready for real change. And really what I want to emphasize today with you is patients recognize the importance of the ethics review and the role REBs play in safeguarding their involvement. But as it stands, it really is an onerous, duplicative, and can present a barrier to access for patients. Patients or participants don't have time for duplications between ethics review boards and provinces. For some people, trials are keeping them alive, and delays to the ethics process can have life and death consequences. In addition, patients voice concerns that if trials cannot get up and running quickly in Canada, international trials will go elsewhere. Along with them are brilliant researchers and their teams and the potential for innovative therapies. And certainly we hear about this on a regular basis, and it sort of adds to the message in that direction. Limited or late access to trials is an equity issue. Variation between the provinces also raises concerns. Patients ask questions like, wow, or, is the trial safer over in that province? Or, wow, am I going to be treated differently if I participate over in that direction? More importantly, the message, and the very strong message from patient partners, is we've been talking about this issue for decades. It's time to act.
So thank you so much, Donna. So really what we're calling the dream here, what we're looking forward to, is really a single REB review process for clinical trials that are happening across the country in multiple sites across the country. And, Alex already referred to kind of what's happened to get us to this point, but we just wanted to remind everyone here that there really was a rigorous process that was set up by the ACT Consortium. The evaluation process included a panel of representatives from jurisdictions across Canada. So we responded to the RFP, and I would imagine many other groups did as well. It was very prescriptive in terms of what we had to respond to and what we had to present. The proposals were scored, and at one point we were asked to come forward to do an interview. The interview was a very formalized process where we were posed very specific questions. We knew them ahead of time, and our understanding that each one of these parts of both our written proposal and the actual interviewed were scored separately and anonymously, and there was a unanimous decision by both the folks that reviewed the written and the folks that reviewed the interview, and that CanReview was selected as the collaboration to move forward. So we're very grateful for that. We don't take this responsibility lightly. We're very much committed to adhering to the extent that is reasonable and sensible to the vision that we put forward, as it was selected as the successful project or vision to go forward. And we're of course committed to our team that's come along with us in this. So essentially what our vision is to work with our boards and our research teams, our Indigenous community members, our institution sponsors, patient and family partners, and others to co-develop this system and bring it to maturation that will improve efficiencies in study startup times, increase Canada's competitiveness in attracting trials. Of course, we want to expand trials to underserved locations and improve equitable access. So next slide. Essentially, we have a leadership team Right now, we have members from 8 different provinces and territories on this leadership team, as well as 2 patient and caregiver experts, and that includes Donna, who you see here today. And we've been meeting monthly since the time that we've been selected as the team to move forward. We need to expand this committee out. Like in a couple of the provinces, we have 1, and we'd probably be more comfortable with 2 people from those provinces. And there are a few provinces where we don't yet have representation. So we'll be working to build that committee out. If you go on the website and take a look at it, if you're from other jurisdictions that you feel are not well represented, definitely reach out to us. I should emphasize that the role of this leadership team, as well as giving guidance, it's to really help us implement this project within their jurisdictions, and they've been incredibly helpful so far. We also have an external advisory committee, so these are members from constituencies across Canada. So we have institutions, national research groups. These are just examples. We have biotech, we have pharma, we have medtech, we have all sorts of folks on this committee that will help us help us create the change we need outside of the individual project to allow everything to go forward. As well, we will be convening several different tables over the next years, including tables of funders, institutional leadership, REBs, etc. These tables will ask to meet as needed to help us move forward the project. We're currently recruiting for our Indigenous Research Ethics Advisory Group. We've had some terrific people come forward, but we need to have more come forward for that. So again, any suggestions are more than welcome. So that's the basic governance for the project. And by the way, I forgot to mention the operations team, and actually it's good timing for that because now I'll invite Matthew Descanio to take over, who is on the operations team. So thank you, Matthew.
Thanks, Susan. So the CanReview will provide research teams and sponsors with a common ethics review entry point and consistent requirements. CanReview leverages CTO Stream, which is an adaptable web-based platform for single research ethics review that has managed more than 2,500 multi-site studies and supported nearly 10,000 users since 2015. The system has been designed for a single distributed REB model, and the REB workflows have been tailored and can be further adjusted to meet the requirements of any REB across Canada. Although the system plays a major part in the submission and review of studies, CanReview is more than just a platform, it is a collaborative framework. We are committed to engaging the clinical trials community, validating REBs across Canada, establishing proactive mechanisms, publicly reporting approval timelines, and advocating to evolve legislation so that together we can achieve a broadly accessible single research ethics review system for Canada. Now, one of those parts I mentioned there, REB validation, this is a critical part to the collaborative framework. REB validation was a part of the request for proposals released by ACT and has to have been addressed in all proposals, including our own. Fostering trust amongst REBs is a critical step in an REB distributed model. The CanReview REB validation tactical team, which I'll talk about in just a little bit, is currently being formulated and will advise on the approach to selecting and validating REBs across Canada-wide, REBs reviewing Canada-wide multi-site clinical trials on behalf of CanReview. So in its simplest terms, the system works like many other REB applications. So an application comes in and it undergoes a single review by an REB. But to break it down a little bit further, this process is initiated utilizing a study-wide application, and upon approval, sites can join utilizing a participating site application. Now, the initial application and these participating site applications undergo an administrative screen, and this will ensure that the REB receives an ethics package that is free of non-ethical issues and reduces the administrative burden on the REB. Furthermore, the screening process will determine if the study is industry funded and therefore if fees are applicable. Now, as we know, most studies will undergo a full board review, and this will be completed by the sole REB of record. Once all questions have been resolved, the REB will approve this study-wide application. At this point, participating site applications can be submitted, and these are abbreviated and contain information applicable to the site conduct of the study only, and does not in any way reiterate or duplicate any information that has already been provided and reviewed by that sole REB. The site application must undergo expedited review by that REB of record. And once the REB issues this approval, that site has completed the ethics required to initiate the study. And once again, we're just talking about the ethics only. All ongoing oversight, including amendments, reportable events, continuing reviews, and study closures, are reviewed by that single REB of record. Now, we are aware that there will be certain provinces that are unable to delegate the ethics review to another board at this time due to active legislation. So we have proactively developed 4 separate mechanisms to support these provinces and institutions. We believe that ensuring this process can support all institutions and REBs is critical to the success of CanReview, and we will work in partnership with REBs across the country to further refine these supports and develop new supports as well. CanReview will be available to all research teams conducting multi-site pan-Canadian clinical trials, available to sponsors, CROs, medical device companies, hospitals, universities, private clinics and practices, health networks, and of course, REBs across Canada. As Donna mentioned, there are many benefits to patients, and other benefits will include defined ethics review timelines with transparent metrics, expanded access to clinical trials and research studies in rural, remote, and underserved areas, reduced duplication of ethics reviews, and a unified and efficient process for multi-site studies. Now, our comms team has been working tirelessly to raise awareness of this initiative, and you may have already seen some of their emails or social media posts. The digital platform CTO stream has been modified to welcome pan-Canadian users. Changes to the digital platform went into effect on February 3rd. If by any chance you are a current user of the system and have any feedback, please communicate it at any time in order to improve the platform and make it the best it can be. And we are also currently in the process of building out committees, tables, tactical teams, and advisory groups. Speaking of tactical teams, the call to join the CanReview tactical teams was sent out the last week of January. Now, 4 tactical teams will be established and meet regularly now through the end of April to support the startup of the CanReview collaboration and a pan-Canadian single research ethics review system. The 4 teams include an REB validation process team. This team will advise on the approach to selecting and validating REBs reviewing Canada-wide multi-site clinical trials on behalf of CanReview. A system timelines and transparency tactical team. This team will review and advise on how REBs and research teams can achieve timely REB approvals and develop a plan for measurable, publicly available metrics. A single informed consent form tactical team. This team will work to develop consent form templates for CanReview studies, incorporating a strategy that accommodates the needs of all participating provinces and territories. This team will consider existing standardized consent form templates to inform strategy and feasibility. There's also the industry fees tactical team. This team will advise on REB fees for industry-funded studies and how these fees will be distributed throughout the system to compensate REBs, participating sites, and support the sustainability of CanReview. And the last tactical team is the agreements tactical team. This team will advise on standard agreements to support CanReview, including board of record delegation agreements and service agreements with industry. There will also be an Indigenous Research Ethics Advisory Group that will be established, which supports meaningful, appropriate engagement with elders and Indigenous research community members in Canada to build a system that works for all. This will be a standing advisory group with no end date. Now, since the call went out in the last week of January, we received lots of interest since then. About 200, maybe more than 300 applicants have come forward to join these tactical teams. And our next steps will be to finalize each team and schedule the first meetings as soon as possible. When formulating these teams, we think it's extremely important that they take into account representation from across the country, expertise in a specific area, and representation from different stakeholders as well. On the last slide here, so we invite all institutions and sponsors to pre-register for CanReview's online system, which will begin accepting pan-Canadian studies in spring 2025. You can register at the link provided on this slide, or if you can quickly snap the QR code there, you can also register that way. We also ask that you follow us on social media, on X or LinkedIn, and that you help spread the word to any interested parties who cannot be in attendance today. And I think I'm passing it to Dawn after that.
Thanks, Matt. Yes, there will be challenges, but we must overcome them. We must overcome them because people in Canada need this. They need equitable, safe, trustworthy trials. They need more of them, and they need them now. A colleague from the CTO, College of Lived Experience, said a year ago, If we are unable to solve these research ethics challenges, we will create even more inequities with respect to access to innovative therapies. Together, we can make Canadian clinical trials more efficient, effective, and equitable for all Canadians. Thank you. Thank you all for being here today and joining us in this conversation. Please feel free at any time to contact us at info@canreview.ca. I know we will answer some of your questions today, but anything that comes up after or any interest you have, please feel free to reach out.